My first job was at a Burger King on Deer Park Avenue, which is one of the busiest Burger Kings on Long Island because it's where all the buses go. And when 3 buses showed up, I was the guy that was like, all right, let's do this. And I was able to just very efficiently, and I became the production manager. And, so I've always been this process oriented, how do we get more efficient kind of mindset around everything in and out of medicine.
My name is Dr. Chetan Sathya, and I'm here today for Northwell's 20-minute health talk. We are super fortunate today to be with Dr. John D'Angelo, the CEO and president of Northwell Health. John, thank you for being here with me today.
Thanks for having me.
Of course, of course. So you recently took over as CEO of Northwell Health, the largest health system in New York. What's been going through your mind over the last couple of weeks?
Yeah, it's day 11. And it's been fun. I've had a couple of years to think about this, between the selection process, the interviews. It's been a long and rigorous, but actually appropriate process to make the selection, and give me a lot of time to think, reflect, not only on my journey, but on how I might approach the role should I find myself fortunate enough to be in the seat. And when selected last May, I've been in a CEO-elect position, which has been great. I've had overlap time with Michael to transition, to think through a lot of different things going forward. And now October 1st is here, and we've been hitting the ground running. So it's a little bit, it's an honor. It's a huge responsibility. Northwell is an incredible organization. I've been with Northwell for 25 years now in a lot of different capacities. And I'm just really proud and really honored, and the weight of the responsibility is not lost on me, but I'm ready to help move the organization and continue to evolve to higher levels.
Incredible, incredible. When I first got to Northwell almost 4 or 5 years ago, and we're both fellow physicians, one thing that struck me at that time and still stays true today is the incredible culture we have here. From our OR staff, our nursing, the folks that clean the bathrooms, you name it. The culture is really exceptional. It's actually one of the biggest reasons I can't leave Northwell, is that culture. And I know Michael Dowling, as you mentioned, really was pivotal in building that. You had the fortune to work with him for so many years.
Right.
What were some of the biggest takeaways from that experience as you enter this next journey in leadership?
Yeah, I think, you hit it on the head. The culture, I believe, is the secret sauce of the organization. It's, I believe, what separates us. It's what kept me here for 25 years. And Michael's done an extraordinary job connecting people to purpose. I've always felt very aligned with that sense of purpose. And like we said, it's what keeps people here. It's an organization that truly does put the patient at the center. It's an organization that the culture is one that doesn't accept the status quo or sit still. It wants to continue to evolve, continue to get better. And that really resonates with me. Plenty of examples of seeing that in action with Michael. So I can give a number of stories, but one that's personal, just speaks to his character, but also speaks to the commitment of the organization. Back in 2003, I was in the Army Reserves. I was mobilized. I was on active duty, stationed down at DeWitt Army Hospital in Fort Belvoir, Virginia. And I was a frontline ED doc, didn't have a leadership role at Northwell at the time. And one of the, talking with other reservist physicians, learned about some organizations have certain programs to help their employees. So I wrote Michael Dowling a handwritten letter saying, Mr. Dowling, John D'Angelo, one of your frontline docs, on active duty, I'm wondering if Northwell would consider a program to help your deployed employees close the gap between their military and their civilian pay while they're on active duty. And he wrote me back a letter and said, absolutely, John, we're doing this. Thank you for bringing it to my attention. And that started a program that I think is still the centerpiece of Northwell's program today. But what was really remarkable, not only how quick he was to say this is the right thing to do and we're doing it, but 2 years later, I was asked to become the director of the ED at Glen Cove. It was my first leadership job in the organization. And I'm in the hospital president's office, and in comes Michael Dowling. I've never met him. This was in 2005. And Michael walks in, and Dennis Connors, the hospital president, says, oh, Michael, this is Dr. D'Angelo, he's going to be our new ED director. And you could see his gears turning. He's like, D'Angelo, you're the guy that sent me that letter. And he remembered from 2 years earlier. And it just speaks to how deeply he cares about connecting to the people, the team members of the organization, and his lack of hesitancy to say this is the right thing to do and we're going to do it. Just a good example of, I think, again, that connection to purpose and why we're here.
It's amazing how many stories people at Northwell have similar to what you just said about a leader like Michael, right?
Yep.
And other leaders in the organization that have fostered that same culture.
Right.
You know, answering emails with handwritten notes, visiting folks on the front lines. You've already been doing that.
Right.
How do you manage it all? Like, you know, I'm a physician as well.
Right.
You know, splitting roles between, you know, you've been an emergency medicine physician, you now have this huge role. In order to do all that, it requires incredible bandwidth. So what are some 2 or 3 big things that you do to actually make that possible?
I think it took time for me to get here, get to this point as far as how I manage that way. I mean, it's not, in retrospect, when I look at my career journey here, I couldn't have planned it any better. I've had progressive leadership roles at bigger and bigger scale over 20 years now. So it started with that ED director role at one community site, evolved to running big system-wide initiatives, sepsis and others, ultimately to running a service line, to then managing all the operations during COVID, to then running the central market the last 4 years. So it allowed me at each step of the way to get a little bit more comfortable with leading at scale, which requires getting the right team around you, building the right operating model of that team, how you align accountability and responsibility, transparency, set expectations, work towards milestones, and really become more and more comfortable delegating and trusting the people that are responsible to you to execute on all the lanes of responsibility required to kind of make the whole thing work. And it's not something that's natural for a lot of us, and it wasn't natural to me early in my career, my leadership career, but over time, and I've been afforded, again, that progressive scale to really fine tune that leadership style. And it also takes a little bit of a personal commitment to understanding that you can have great impact and impact more and more lives and more team members as you get into these larger roles, but you have to do so through others. And you got to be really comfortable with that, because it's not the same as being at the bedside, managing a case in that particular moment. So I had to come to grips with I can impact many lives, even though I've stepped further and further away from the bedside.
Yeah, no, I mean, that really resonates.
Right.
And, one thing that has struck me in my residency training and my current surgical career is, and just across medicine, not in Northwell necessarily, only Northwell, but across any institution I've been at, is that physicians are not always the best leaders, right? We see that in academia, we see that in chairs, right? We tended to promote academia, for example, versus people management and those skills. So talk a little bit more about, as an ED physician, right? You demonstrate different types of leadership, and how that pivot happens,
I think
when that happens.
There's specific to me, I think emergency medicine was a big contributor to my ability to lead the way I've been successful leading. And I can talk about that. And I think part of it is also everybody's different. It's not a matter of I got an MBA, all of a sudden I'm a great leader. So some of the I would like to think attributes that have helped me be a better and better leader are things that have been with me since childhood. I mean, being a real servant leader, being very aware of and committed to community relationships, helping others. As a kid in the Bronx and my very tight family, I learned a lot about community and sense of community and service through my parents and others. I think that played into it. Secondly, I've always been someone who, just the way my brain is wired, I look at things and I'm always trying to figure out how to do them better. And it didn't matter if I was, I joked at New Beginnings the other day, yeah, my first job was at a Burger King on Deer Park Avenue, which is one of the busiest Burger Kings on Long Island because it's where all the buses go. And when 3 buses showed up, I was the guy that was like, all right, let's do this. And I was able to just very efficiently, and I became the production manager.
Yeah.
And, so I've always been this process oriented, how do we get more efficient kind of mindset around everything in and out of medicine. Emergency medicine teaches you to be comfortable leading through uncertainty. It teaches you to make decisions even when you may or may not have all the data or information you'd like. It teaches you to really pay attention to the outcomes of those decisions and not being anchored on the decision, but more based on the outcome, know when to pivot and when to change course. And more importantly, I feel it's really an arena that really teaches you the value of teamwork and how every person, both around the bedside, regardless of role, and the people that are supporting you outside of the room, play in the synchronization of all of the activity that has to happen to deliver the best care. And I think emergency medicine teaches you a lot of those skills and a lot of those perspectives, and it's really served me well throughout my career.
Yeah, I mean, the team aspect really matters, as you've highlighted. It's so interesting, whether it be surgery, ICU physicians, pediatricians. I mean, the physicians that can really harness a team, empower them, and trust them, and stay calm, in uncertainty. It leads to exceptionally better outcomes, and I think that's such a key aspect that you bring up. Yeah, you mentioned your first job at Burger King. Tell me a little bit about your parents and how they instilled this sense of community.
Sure.
And, a little bit of that upbringing. Like, how did you decide to have that job at Burger King, and how your parents raised you?
Well, my dad was just always a very hard worker. So I remember he was in the Navy when I was born. I don't remember those days, but we had the 8mm films of those when he was in San Diego. And my earliest memory is my dad driving a cab at night while he was an apprentice. I think it's a 5-year apprenticeship for the electrical union, and just working hard, but always helping neighbors. He was the one. And my mom has 6 sisters. I always remind Michael, I'm actually half Irish, so big Irish family in the Bronx. So my mom's 6 sisters, my 21 cousins. My dad was one of the few that had a car. We were always the ones driving everybody to their doctor's appointment, helping people move furniture around or fixing things in the apartments or whatever. And I used to love being at his side, carrying the toolbox and learning. So always wanted to learn, always really liked doing things with my hands, always took some sort of special pride out of helping other people, and that's what I witnessed. So therefore, I think that stuck with me. So I think that's the main thing I took out of my upbringing. And I happen to also be very good in school. So the 21 cousins, I'm like number 13 and 14 in line. I was the second to go to college. Most are in the trades, which is great. And they're all great people. I was the kid in the family that was always really good at school, really good at math and science. And from being a little kid, everybody used to always say, oh, he's going to be a doctor. He's going to be a doctor. Yeah. And it just stuck that I was going to be a doctor. And so it was no big tragedy or no life story that drove me to be in medicine, other than the fact that I really valued helping people. I really loved what I witnessed growing up. I loved math and science, and it just seemed like a natural fit and a natural progression. And it was almost like declared, not only by me, but by my family from a very young age.
That's who you were gonna, what you were gonna do.
Yeah.
It's remarkable. I mean, physician and now CEO. I always think about this for my own kids too. What are the values you want to instill in them? And I feel sometimes, increasingly so, there are fewer people that really have that mentality that you need to work very hard to achieve great things. Right. And again, I bring this back to how I'm raising my kids. How did your parents instill that in you? Is it through seeing what they did and how hard they worked? Was that immigrant mentality? Was it people around you?
I think it was partly through witness and example, just watching. And then it's interesting because I was, not coming from a family that a lot of folks went to college. I had to do a lot of this on my own, not because my parents didn't care or pay attention to it, just didn't know. So I only applied to 3 colleges, did it on my own. Back then there was no internet, so you got the big book in the high school and you're going through. Got accepted to all 3, and then I think my dad hit sticker shock. Had a union. His union gave me a scholarship for a few thousand. Burger King gave me a scholarship. I worked all through college. I had to pay for it, and it was just. It's what I witnessed my whole life, that if you want something, you got to work hard for it. So it never questioned me. I never complained. And worked right up through 3rd year of med school. I always had jobs, always trying to pay as much of it as I can on myself. And then it just became, so I like to think, like you mentioned, our kids. I have 6 kids, and the older 3 and the younger 3 are completely different. And I joke about it with my wife because the older 3 saw those years. They were old enough to understand what was going on and watch me work as a resident 100+ hours a week. Watch me work my first job trying to pay off debt, working like 28 days a month because I would take per diem shifts wherever I can get them and work for the first 3 or 4 years. They lived with me and my wife in the basement of my in-laws' house while we saved for a house on Long Island because we couldn't afford to live here. And then you get to the younger 3 who were here when I was now more stable. And they were the ones that instead of the vacation in the back of the car, we went to Disney every now and then and so forth. So just different perspectives. But I tried to instill in all of them the value of hard work. And more importantly, comes back again, the purpose. We're very blessed as a family. I want them to do stuff think about what they want to do with their lives, where they're going to be most satisfied and fulfilled, and try not to get them focused on, the material things or, even the prestige of it, like what's going to make you the happiest. And I think, and I think that's why I do what I do. I mean, it's again, coming back to tied to purpose, tied to the mission, tied to the impact you can have. And I think if we can instill that mentality in our kids and they're willing to work for it, great things will happen.
6 kids.
Yep.
I thought I had it bad with 3. How do you make time for family dealing with all this right now?
Part of my journey has been not only learning how to be a leader at different stages of and I wasn't always perfect in any of these paths, but I also had to learn how, especially as my roles became more substantial, there were times I wasn't the best person I could be at home, as a father, as a husband. There was times, especially in my earlier leadership roles, where I wasn't the best at taking care of myself. And it was very common in a new role, put on 20 pounds, stop doing the routine for 2 years, hunker down, and just get engulfed with the work. And the work is important, but I've learned over time how to be really intentional with focusing on all 3 lanes, my family, my own personal health, and being successful at work. And it takes deliberate kind of planning and strategy, and it takes intention. And as an example, like 2012, I became the service line lead. So I'm now running at that time 13 emergency departments, 2 urgent cares. Over the subsequent 10 years, it grew to 21 emergency departments, 70 urgent cares, EMS operations, things that I was responsible for. And in the first 2 or 3 years, I did exactly the same old, worked tirelessly, but that included weekends, meaning laying in bed at night, thinking of things and writing down on a pad, just constantly thinking about the work. Put on a lot of weight, and so forth. 2015, I just came to a kind of a conclusion, and my wife and I decided we were going on a journey together, and we really started to focus on not only our marriage, but our health, nutrition, exercise. I dropped like 60, 65 pounds. Wow. I've maintained the same lifestyle since. It's almost 10 years now. And it's become part of us, and it's part of our routine, including date night once a week and, making sure one of us is always at somebody's sports game or whatever. So we just put a lot of intention into it and focus on it. And there is a way of doing all of them as long as you're focused on that. And I think for our employees, I want that to also be part of what I lead by example. Like, I'm not going to be shy about going on vacation,
Yep.
going on the college trips, and the work will get done. I will serve the needs of the organization, but people need to figure out a way to strike that balance so they can be their best selves at home and at work, and then it'll benefit all of us. So I think it's an important piece of our culture we have to continue to work on, is how we make sure we're doing everything we can to give folks access to all the resources they need to take the best care of themselves.
That's so incredibly refreshing, because it's, particularly in medicine, I mean, it's such a badge of honor to kind of kill yourself.
Right.
And, work yourself into the ground. But what you're mentioning is just incredibly important, particularly when a job you're in is so physical. Right? Mentally, emotionally, physically, going to meetings nonstop, 5 a.m. till midnight and so on. Thank you, Dr. John D'Angelo, President and CEO of Northwell Health, for being here today. And a special thank you to our viewers and listeners for joining us for this episode of Northwell's 20-Minute Health Talk, where we will discuss healthcare's most pressing issues with worldwide experts. Thank you.